Hey everyone! Today in this video, I want to talk to you about patient safety plans and why you should have one. Today we're going to talk about what a patient safety plan is. We're going to go over the Brown Stanley Safety Plan, and then we're going to talk about why you should have one. So first, what is a patient safety plan? Now, if you've ever been to a psychiatrist or counselor, you may have already filled one of these out. But basically, it's just a list of support systems, coping skills, clinicians, and what you should be doing in case of a crisis. So the most common one that is used is going to be the Brown Stanley Patient Safety Plan. This is the one I personally use, and I think it's great because it covers all the bases. So just really quick, I wanted to run through you and kind of give you an example of what it should look like. So first, the first question is going to be, what are your warning symptoms? What are your thoughts, images, moods, behaviors that a crisis may be developing? So for me, that's family stress or sometimes seasonal changes. I know I get depressed in the fall and manic in the spring, so it's important that I have those down. Number 2, what are the internal coping skills that I can do to take my mind off my problem without contacting another person? So if you're into meditation, maybe that. I go for a walk or a run, things along those lines. What are the things you can do without contacting other people? And then number 3, people in social settings that you can go and talk to that provide distraction. So for me, this is like going and getting wine with my girlfriend Erin, maybe going to the movies. And number 4, who are people that I can ask for help? So that's going to be my best friends, my friend Erin, Tracy, Mikey, and then it has their numbers listed. Now, I don't particularly usually put my husband down on these because by the time I've gotten to needing to utilize my patient safety plan, he's probably given me all the support he can. And so it's important that I have multiple people surrounding me when I'm in crisis. Number 5, what are the professionals that you can count on? So I have the number of my counselor, my psychiatrist, the local ER, and the local mental hospital. Those are the things I put down. And then what can I do to make my environment safe? So removing things that I may use to self-harm, getting maybe rid of the alcohol in your house, or even learning to leave and walk away for a little bit. And then the last thing is, what's the most important thing I have worth living for? And that's my sons. So see, it's that simple. I literally took you through my entire patient safety plan in a matter of minute and a half or so. So it's that simple. So why should you have a patient safety plan? Well, one, when we're in crisis, we typically are not thinking straight. So it's nice to have a reference of all of the things that we can do to help bring us down out of that crisis. It's also a good reminder of who your support system is. I know that in my depression, I feel so lonely sometimes, but I can look at this and remember that, hey, if I pick up the phone, Tracy's going to answer and I can tell her whatever I need to tell her and she's going to be there. It's also a good reminder of what coping skills you already have. If you're in therapy or counseling, you're most likely learning new things and working through problems. But everybody has coping skills, whether they're good or bad. So what are the good coping skills that you already have? It also has all of your crisis numbers on hand. Now, I particularly keep a patient safety plan at my work because I work with people in mental health and addiction. And so it's nice for me that I don't even have to look up numbers. I can literally grab this piece of paper and go, look, this is the National Suicide Prevention Lifeline. This is a peer support, recovery talk lifeline, things along those lines. So it's a great reference in that as well. But most of all, you have a plan for the bad days because there's going to be bad days. I know I have plenty of bad days and I need to be reminded of what I can do on those bad days to make them less severe. Here's the thing. Having a safety plan allows you to have peace of mind knowing that you have something in place to keep you safe and supported during your time of crisis. So if you don't have a safety plan already, I want to strongly encourage you to go online, just Google a patient safety plan, There'll be lots of references. You can print it off and fill it out yourself, and I promise you, it'll be a great addition to your mental health journey. Hopefully this video was helpful for you in your mental health journey. If you liked what you saw, make sure to click the subscribe button and give it a thumbs up. Until next time, have a great day.